Hi, I'm Hutchins, and my final project is on Recombinant, which is a recombinant DNA technology from genetically modified CHO cells. Recombinant was developed through using recombinant DNA from genetically modified Chinese hamster ovary cells. This is then structurally identical to the human thrombin. This was accomplished by prolytically converting an active two-chain form of protein derived from snakes, purifying the protein through chromatographic process, and yielding the product. The recombinant recombinant is used to maintain homeostasis in the human body when there is any oozing of blood in capillaries and surgeries. So this is used as a topical treatment. So this product of recombinant was created by Zymogenetics, which is a biotechnology and pharmaceutical company that's based in Seattle, Washington. It was established by two men from the University of Washington that then started creating recombinant DNA therapeutical proteins in order to use in surgeries and medical settings. This was then acquired by Bristol Myers Squibb in 2010. This company is now producing the recombinant. So Zymogenetics was the first biotechnology and pharmaceutical company that was established in the US. Recombinant was the first FDA-approved recombinant protein technology that Zymogenetics created. This was then absorbed by the Bristol Myers Squibb, like I said previously. So this drug is used as an aid in homeostasis, which is used in surgical operations. So this isn't really a disease treating or curing recombinant DNA technology. This is more of a practical use for normal surgical procedures in hospitals. So it's used for whenever there is minor bleeding in the capillaries from a suture, lesion, or a cautery, according to the FDA. So thrombin is an enzyme that's naturally produced in the human body that converts fibrinogen into fibrin. This is a key step that is used in the formation of clotting. So this topical thrombin is used in normal surgical operations, as I said before. This is used to help in surgical procedures when the standard surgical techniques are not effective in stopping blood loss and creating blood clots. Recombinant thrombin, or recombinant, has been proven as effective in clinical trials of 411 patients undergoing different procedures, controlling any bleeding in under 10 minutes. Studies by the Journal of Vascular Surgery also came to the conclusion that recombinant thrombin, compared to bovine thrombin, provides a more rapid onset of hemostasis at 3 minutes, as well as recombinant thrombin demonstrating superior immunogenicity profile. Bovine thrombin has been associated with the development of antibodies that can cross-react with human factor B, which is human thrombin, leading to life-threatening coagulopathy and a considerable mortality rate. Recombinant thrombin has been found to be a better option. Lots of people in society are now needing this because there is an increase in clotting disorders. You can see this demonstrated in the figure of the thrombin market. We can see that there is an increase of 51% in the market for bovine thrombin. Human thrombin has also increased, as well as recombinant thrombin. The increase in obesity also creates more demand for recombinant thrombin because of the increase in surgical procedures of heart issues. This drug is mainly marketed to hospitals, and the projected sales are as stated in the Fortune Business Insights. The company that originally created this drug is now out of business, but we can see from the global thrombin market size of 2015 to 2026, we can see that there was an increase in thrombin from 305 million to 738 million. In this next figure, the global thrombin market share of each product, we can see that bovine thrombin makes up about 51% of the market, where 25% is human thrombin and 25% is recombinant thrombin. The major competitor to recombinant thrombin is the bovine thrombin, which is created by King Pharmaceuticals. This pharmaceutical company then isolates the thrombin from bovine plasma. Bovine thrombin seems to act the same as recombinant thrombin, yet there is much more immunogenetic problems that happen with patients that do have bovine thrombin used during their surgical procedures. There is also human thrombin in the market called Evithrom, which is taken from other individuals and then used in surgical procedures. Although this thrombin is taken from human plasma, which carries the risk of transmitting viral and infectious diseases through those transplants. The use and production of this specific drug, Recothrom, makes it easier to create thrombin at our demand, and there's no shortage of it ever because we don't have to worry about taking it out of human. So far, there aren't any ethical or moral concerns with the use of this drug since it is just a minor clotting agent. The societal impact of this drug is just seen in surgical procedures, so we see an increase in the use of this in basic medical, surgical settings. Recothrom is used in normal surgical settings and impacts our society in a great way by allowing for us to have agents in surgical procedures that allow for the homeostasis of clotting. Thank you for watching my video. This was my presentation on Recothrom.